Hey, good morning, everyone. This is CJ Ehrentrout, along with my colleague Valerie Ostrander. We are both managers within the revenue cycle team of the Healthcare Consulting Group. We're going to be talking about some hot topics with COVID-19 that have come up over the past couple months, and we hope that they capture your attention. So our agenda today is going to be short and sweet, but very important. We're going to talk about patient billing communication during the COVID-19 pandemic, updating your charity care policy, remote workforce and staff education, and then some resources for you to help you out along the way. But before we go there, this slide is very important because there's no way any of us could have predicted this crisis. You know, the onset of COVID-19 has made organizations transform and operate in new ways. I think we're all trying to figure out what our new normal is going to be. Decreased patient encounters, furloughed staff, and evolving billing policies are just a few examples of what we're all going through. The hot topics discussed today should be on the radar of leaders across the country, and as always, here we at Mazars are here to help every step of the way. So with that, we'll jump into our first topic. So I was thinking about this, and I can remember being on a client site back as early as April, when payers started to try and adjust to the COVID-19 pandemic. And I can remember getting sometimes weekly or monthly emails from all the different payers giving us updates on trying to help out the patient with co-pays or cost sharing. New codes have been developed to try and ease the tensions of providers trying to get paid for the services. And due to this, many organizations have decided to hold charges related to COVID-19 until payer portions have been determined. And bills that have otherwise would come very quickly could end up not reaching the patient for months. So I say that to say that it's very important to let the patient know what's going on as well. We might know as the provider that we want to do this and why we're going to do this, but a patient may not. They may not know. And this conversation can happen as early as the pre-reg conversation or when the patient presents at the front desk. Each place is going to have a different, unique situation when it would be the best to have this conversation with the patient. But the key point here is make sure that they're aware in the thinking process that you're going on. Here's some recommendations. So like I said, you want to be proactive and be empathetic. I've talked about the patients who have insurance that they might have, you know, they were expecting a certain bill, but there's also patients out there that have felt this pandemic in worse ways. They could have been laid off. So they're now a self-pay. So for these, you know, you want to provide new payment options and remain flexible. We got to remain empathetic with these people, right? When's the last time that you searched and updated your FAP policy? Is it easily accessible to them online? There are organizations out there and companies that try and push us as far upstream as possible. There's tools to put it online to start that process, knowing that there's going to have to be some type of document follow-up down the road. But what does that language say? Is it empathetic? Is it up to date? And also, how about you're extending your payment plans? The new normal might not look as you did last year or in the past. You might be searching for a minimum dollar amount or a minimum amount of months. But we want to help the patient out. When's the last time you looked at those policies? Is it time to update that now to allow them to pay that bill in a manner that fits their life? And with that, I'll hand it over to Valerie so she can speak about how to train your staff and the rest of the agenda topics.
Thanks, CJ. So as you're thinking about this, your payment plans and everything, you want to make sure that when you're talking with your patients that you're also setting those realistic payment expectations. Like CJ was saying, you know, when you're talking with your patients, you want to be upfront and let them know, you know, they do have their own responsibilities as their for their patient portion. And there are organizations out there that can help patients with that patient portion if they do not have insurance, or even with some of the they're paid their premiums, or just financial support, even with some of the other things that you may not necessarily think about. So like HealthWell or the Pan Foundation, NORD, which is the National Organization of Rare Disorders, they are helping out with a lot of things that you wouldn't think about, like financial assistance as far as housing, transportation, different things like that. So those are reasons they reach out to, and patients know about. They could tune up with medical bills, but other things that you might want to look at are your payer contracts. Really kind of look to see what's in your contracts. Are there things that you may be able to extend? Talk with your payers. See what's really going on. What are they doing with some of these COVID tests? Are they offering them as complete? Are they offering 100% payment? Are they offering as a bundled service with something else? Are they doing it through telemedicine? Is that an option? How are different things? What's going to benefit your patient the most? And really kind of screen your patients. Make sure that the information that you're getting from them is accurate and correct. Because if you're going to be looking for any financial assistance for your patients, you want to make sure that you have the best information and letting them know that why you're getting this information and why you're pulling all this information for them. It's to benefit them and to help them out in the end. And then while you're thinking about your patients too, you want to also think about your workforce and your staff and educate them. Because remember, you furloughed some of these people, you have some of these people working remotely to support your staff. Reach out to them, have daily, weekly, send them some FAQs, kind of keep them updated on what's going on in the office, what's going on at the hospital. How are things going? Have some huddles, keep them updated. Where are we going? What's going on? Are we bringing people back? When are we bringing people back? What's going to happen when we do bring people back? How are things going to change? Are we staying in a remote environment? Are we going to do a phased approach? What are we doing? The more that you keep communication, the better off that we're going to be. A lot of organizations have gone to, Zoom, right? That's what we're doing right now, having Zoom meetings, right? Everybody's Zoom. A lot of people are Zoomed out, but have a Zoom meeting, have a Zoom happy hour. That's a big thing. Get everybody together, do some fun things, keep everybody engaged. You want to keep people engaged. Let them know that they're not alone, right? You want to keep them socially engaged, not socially distant all the time. Another thing I want to remind you of too, as CJ was bringing up about payments too. You do have the CARES Act too, and you want to look into that too, because there are some things that out there for providers for payments that they may be able to recoup some of the monies that are out there too. So you want to look into that and see if there's some funding there that you may be able to get some reimbursement for that you may not otherwise qualify for. So that's another resource out there that you may want to do. You can go ahead and forward the slide. So here's the other resources out there too. These were a couple that we were using for this presentation that we found very helpful, but definitely go out, reach out to look at each one of these. And the next slide here has all of our information on it. If you have any questions, don't hesitate to reach out to either one of us. We'd be more than happy to help you out, answer any questions that you have. And thank you again, CJ. Anything you want to add?
No, we just want to say thank you to all the frontline workers out there for all that you're doing. Like Val said, please don't hesitate to reach out to us and make sure that these hot topics are on all the minds at leaders in your organization.
Thank you again.